Good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently Monday, July 27th, just about 7 o'clock. And I want to do today's daily recap of events that affect the way you get, protect, and enjoy your money, your life, and your retirement. Now, the question for today is, do you want to feel better? And I'll get to that in just a few minutes. We start every day, as we've been starting since March, when I started doing these things with the current COVID situation, because again, that's the biggest driver that's affecting everybody pretty much worldwide at this point in time. It's sort of scary, a little bit of a resurgence in some cases over in Spain right now. Right now, the U.S. cases are 4,275,000 cases. That's up 184,000 since Friday when we spoke last. Now, of the new total cases, basically 30% have recovered, and about 4% have actually died. So again, you've got about a 4% chance, if you get COVID, of actually dying. Despite what's going on social media, a lot of people are just still poo-pooing this until it affects them directly. And then all of a sudden they change their minds. Right now, the current deaths in the US are 147,285 people have died. That's up basically 1,000 people that died since we spoke last on Friday. Now, California has the number one spot, and they've had that for almost 2 weeks now, maybe three. And their current cases are 453,155. So they're up again 21,000, almost 22,000 cases since Friday. And they've had basically 8,455 people have died. So an extra 155 people have died since Friday. Now, for the big news, which is not really any real big news, you should know this by now. Okay, Florida has risen to the number 2 spot. Okay, remember when New York was number 1, and nobody really believed what was going on. They were all overreacting. It was all fake news, and they went on and on and on and on. Well, California took the number 2 spot, a couple weeks ago. Then they moved up to number 1. New York dropped down. Florida right now, as of the weekend, has got the number 2 spot. Okay, New York has dropped to number 3. Okay, so amazing things are happening down in Florida. Again, even people in the state, some don't believe it. It depends on what section of the state they're in, whether they've actually been affected personally or not. Again, when you're affected personally, things change. Up until the point where you actually know someone who's been affected by COVID, until you physically know someone who's been affected, okay, it's easy to say this is all fake news, all media hype, and all the numbers are overinflated. Until you find out that all of a sudden you or a family member or coworker have it, and it wasn't anywhere near overinflated, it's actually understated at this point in time. So New York's got the number 3 spot, Texas has got the number 4 spot, New Jersey's still sitting at number 5, Illinois is at number 6, Georgia's at number 7, Arizona's still sitting at number 8, Massachusetts is at number 9. However, Pennsylvania dropped. Okay, right now North Carolina has a number 10 spot. Again, interesting things are happening. Now, as things continue to heat up, and more and more people are realizing this is sort of serious. And again, if it affects you, you notice it. If it doesn't directly affect you, it's very, very easy to get wrapped up in the hype and all the nonsense is going on Fox News and on social media, saying that this is all make-believe, it's all overstated. It's not. It really isn't. And you will eventually, if you don't believe that today, you will eventually believe that when you, a friend or a coworker, comes down with COVID. And right now, it's just a matter of time. It's just a matter of time. Right now, President Trump's National Security Advisor, Robert C. O'Brien, his National Security Advisor, tested positive for COVID, according to the White House today. Now, O'Brien is the highest ranking Trump official, in the White House administration to actually have tested positive. Now, a statement from the White House said he has mild symptoms and has been self-isolating, and working from a secure location off-site. And there's no risk of exposure to the president or the vice president. And that's what they say. Who knows what's the real truth going on there? Okay. But again, okay, the president did his event out in Tulsa. All of a sudden, 6 of his advanced people, okay, part of Social Security, the Secret Service detail that did the advanced work on that, 6 of them got COVID. A number of people have since had COVID. And now, again, right into the White House. The president, vice president, they don't have to worry about it. They get tested every day. And if you come in contact with them, you're pretty much getting screened. So right now, the work of National Security Council continues uninterrupted. Now, O'Brien's is in frequent contact with Trump. However, it was not immediately clear how recent the two men had been in close proximity. Now, at least 3 states on Monday, okay, today, reached new record highs for their weekly average of single-day infections. Oklahoma had 1,000 cases, 20% increase from its previous high. Missouri and North Dakota both had 6% increases from their previous records. Okay, new states on the horizon here. Now, the Monday numbers are typically lower in any given week because of the lag time from reporting in the weekend. They make the states really more notable. Again, you haven't heard of these states, and now they've got major increases. Right now, shortages of healthcare workers are worsening in Houston, Miami, and Baton Rouge, and other cities battling COVID outbreaks. They're exhausting staffers and straining hospitals' ability to cope with the spike in cases. Well, that wasn't really any surprise. It was just a matter of time. Again, all these people, when New York was going crazy, couldn't keep staffing. They're working 18-hour days, 15, 18-hour days, and then sleeping in their cars because they want to go home to their families. Everybody poo-pooed that. Oh, it's make-believe, they're overreacting to things. Well, it's hitting other parts of the country right now, folks. And that need is especially dire for frontline nurses, respiratory therapists who have actually hands-on bedside roles when one nurse is required for each critical ill patient. Many hospitals have devised ways to stretch materials and resources, converting the surgery wards into specialized COVID units, since the surgery wards they're really stopped all the elective surgeries because they don't want them in the hospital. Now it's far worse. It's really difficult to stretch human workers. You just can't do it. There's only so many of them. And at the end of the day, the capacity, you need to balance the care between the people, the staff, the space, and the stuff. And you can't have a bottleneck in one. And if you do, you can't take on additional patients. Now, this is what a senior physician policy researcher from the RAND Corporation, the director of acute care research unit at University of Michigan, had to say. You have all three. You can't have a ventilator and not have a respiratory therapist. Now, increasingly, the overrun situation reflects packed hospitals across large swaths of the country. More than 8,800 COVID patients right now are hospitalized in Texas. Florida has more than 9,400, and at least 13 other states also have thousands of hospitalizations. Now, fatalities in several states, including Texas, South Carolina, Indiana, have in recent weeks reported shortages of workers, pitting states and hospitals against each other, trying to recruit actual staff. Now, just weeks before schools open in Florida, the number of new cases and hospitalizations due to COVID-19 has actually surged. On July 16th, the state had a total number of 23,170 children ages 17 and under who had tested positive since the beginning of the pandemic, according to the Florida Department of Health. Now, by July 24th, that number jumped to 31,150. That's a 34% increase in new cases among children in just 8 days. And more children in Florida are requiring hospitalization. And again, they're not certain of how this disease progresses in kids. Many strange things are happening. Some people have very mild cases and they seem to clear. Some people have mild cases, but they have symptoms that go on for months. Some people have moderate cases and they have moderate symptoms that persist for months. Some actually end up on a ventilator and die very quickly. And the kids, they're having some strange reactions and they haven't quite pinned that down as to what's going on with that just yet. Now, by July 24th, the number had jumped to 303 people. Okay, the Florida judge, okay, today upheld county's coronavirus ordinance that required masks to be worn in public places, such as stores, saying government officials have the authority to protect residents from the spread of infectious diseases. Now, the judge, noting that Palm Beach County's recent spike in cases and in deaths, rejected the challenger's claim that recently enacted ordinances violated their rights to privacy and personal autonomy. Okay, you hear these things, and this is what's happened to these cases. Okay, now this judge cited a century-old U.S. Supreme Court ruling that said the state can mandate vaccinations. Several Florida counties and cities have enacted similar ordinances in recent weeks as COVID cases and deaths have skyrocketed among the state. Now, at least 1/4 of Florida's city or county ordinances are right now being upheld. The Palm Beach ruling came as Florida surpasses 6,000 COVID deaths, and almost 40% of those happening with the current spike that began just about a month ago. Now, the state health department reported another 76 deaths, bringing the number of people in Florida who have died of COVID from March 1 to at least 6,048. 2,400 of those have died during July. Now, the state recorded 8,892 new confirmed cases just today, bringing the total to almost 424,000 in the state of Florida. The positivity rate for the test for the last 7 days is 19%. That's about where it's been for the last 3 weeks, but 6 times higher than it was just 2 months ago before these cases started spiking. Now, as at least 14 now Miami Marlin players and coaches have tested positive for the COVID. Okay. The outbreak has come in just the last 3 days into the MLB season, okay, and caused the cancellation of the team's opening game on Monday. About 4,000 federal employees are seeking disability compensation on the grounds that they contracted the COVID at work, while the survivors, 60% decreased employees, are seeking death benefits for the same reason. The number of claims is expected to increase to 6,000 within just weeks, according to the Department of Labor. Target and Dick's Sporting Goods announced that they'll be closed on Thanksgiving Day, okay, the traditional start of the holiday shopping season. Planet Fitness announced that all its gyms and all the gym goers, employees at more than its 1,500 locations will now be required to wear masks. It's spreading, folks. People are catching on. This is real stuff. Now, right now, the Republican Senate and the White House still don't have their plan bill together worked out yet for their next COVID relief package. Okay, so they're really up against the wall trying to do something before the August recess, because they're not going to work past it. Now, the Democrats already passed their HEROES Act 2 months ago and are ready to go as soon as the Republicans can come up with some type of agreement with themselves. There's probably going to be some type of extension for unemployment benefits, but likely not at the $600 a week level that we've seen so far. It also looks fairly certain that there'll be another $1,200 check going out, but probably with some limitations based on incomes. Now, that really brings me to the question for today. Do you want to feel better? Now, without a doubt, these are challenging times. And a lot of what's going on normally, okay, and then you add on top of that the last 6 months, it's really twisted most people's way they could never imagine that their life could be. Your daily routine has changed from a year ago substantially, and it wasn't your choice. The economy is totally different now than it was a year ago. And for some people, it's still okay. For others, it's put a serious crimp in their cash flow. There's still a group of people that are out there denying the depth of the COVID problem. These same people are busy posting nonsense on social media about their rights being overridden because they're asked to wear a mask. Federal mercenaries are now the new secret police, and they continue to inflame already tense situations in several cities across the United States. It's roughly 100 days before the elections, and each side has already really dug into their positions. The mental stress of all this has already started to make people physically ill. And then you need to go to work and feel even worse. So do you really want to feel better? Okay. You may know that, I've already been hardened by 30 years of reviewing scams for both myself as well as clients. Okay. I'm not really an overtly religious guy. I'm really not, even though I was raised Catholic. And with that said, many people still dread the thought of going to work. And it's an ugly feeling. And it can ruin your day, your week, your year, and for some people, their entire life. Do you want that to change? You can't change it immediately. I'd like to be able to do that, but I can't. Okay. But you need to do something because you still need to go to work right now, at least for today. You need to go to work. However, you can change how you feel about it. Now, the easiest thing I find is to start the day, shortly after you get out of bed, just sit, some quiet time with some paper. Write on a paper what you're thankful for. Very simple. What are you thankful for? It will change your attitude. It will change the way you look at things and the way you respond to situations as they come up during the day. Just, what are you thankful for? For me, this is really, really easy. I'm exceptionally thankful for my wife, Dr. Terry. It's the best relationship I could ever have asked for. She doesn't need to agree with me all the time, and believe me, she doesn't. And anybody who's married, you understand that. But we have a lot of intelligent conversations. I enjoy spending time with her. We can just sit at home and have wine and cheese and have some quiet music. I'm a very happy boy. I really am. Now, find out, what you're thankful for. Find out what that one or two things is that you're actually thankful for every day. Write it down first thing in the morning. Savor what you have. Don't just look at it and say, oh yeah. Actually say, enjoy it. More than enjoy it, savor the fact that those things are in your life at this point in time. You'll be surprised how quickly, with just a little bit of practice, all the nonsense of the day starts to drop away. And that feeling, will actually change, carry over for the entire day and actually change the way you feel. Now, I'm Dr. Fred Rouse, the Real Money Doctor. My only goal is to help you to get, protect, and enjoy your money, your life, and your retirement. And I want to help you do that. And I want to help you have as many days that you can feel good as possible. And if you're ready to actually take control of your life and your time and your money, so you can give yourself the option to retire in the next 3 to 5 years with the cash flow that you'll actually need to maintain the lifestyle you want and do the things you want to do without ever having to worry about a job again or money, go to my site, drrousenow.com. See if I can help you live your life without regrets. Help you be thankful for the things that you have and actually give you the ability to savor them the way that I know you'd like to. Now, I appreciate spending time with you tonight, and I look forward to spending some more time with you tomorrow around 7 o'clock. Thank you.